This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Welcome back to another solo intro to an impactful healthcare conversation. This is Lester Morales, the host of Impact Healthcare, and I hope that you got a lot of value off of last episode with the Rosen Health. And Rosen Health really talks about what my shirt says: health insurance does not equal health care. And today, we're going to have a conversation that kind of flips around that conversation, where we can't do a good job with health care without the health insurance being structured correctly. And all of that needs to have a foundation of transparency, a foundation of data, a foundation of aligned incentives, a foundation of fiduciary responsibility. And as I'm recording this, a couple of weeks ago, the news dropped. So we've all heard, and if you haven't, I need you to Google this thing. We've all heard Ford and Heinz and labor unions suing their insurance companies or their pharmacy benefit managers for not allowing them to be a fiduciary, right? Like, in order for me, if we think about the definition of a fiduciary, which all of you that are listening to this as employers, you are the fiduciary of your plan. Just like on the workers' comp side, you have a fiduciary committee, and that has a lot more scrutiny. Hold on to your britches. Our industry as health insurance is absolutely going to be going down that road. And the conversation that we got to have here is, are you able? I need you to ask yourself this. As an employer, are you able to be the best fiduciary of your account? If you're an advisor, are you delivering a solution to your clients that allows them to be the best fiduciary? And if you're working with some of the major insurance companies, and that's 100% of what you do as an advisor, and that's most everything that you're grabbing as solutions as employers, I hate to be the bearer of bad news, but you're not. Do you have access to all your data? Do you know how much is actually paid for that MRI? Do you know what the actual cost of the MRI is? Do you know what they bought that drug for, what they're selling it through the plan? So back to the suing conversations. Well, Heinz and Ford have sued insurance companies, major insurance companies, Blue Cross and Blue Shield, Anthem. They've sued PBMs. But with this news a couple of weeks ago, with Johnson & Johnson being sued by one of their employees, sued their employers. And I need everybody to understand, when you play in the health insurance world and we are underneath the guidance of ERISA, what ERISA is telling us about the fiduciary responsibility that you as an employer have, it is not only the organization. If you are a C-suite member, if you're a K-1 earner, if you're an owner, you are personally liable. And what you'll see in this lawsuit, and we're going to link to the lawsuit itself, but one of Johnson & Johnson's employees sued them, the employer, for lack of and breach of their fiduciary responsibility as an employer. That makes my head blow. One of the employees, because they looked and saw a drug that was running through the plan at $10,000 could be bought cash, like $75. And the irony of this, like, Hollywood couldn't even make this up. The irony of this is huge, where the realities of the irony is that Johnson & Johnson is a manufacturer of pharmaceuticals, and they were sued by one of their employees for breach of their responsibility, their fiduciary responsibility on specifically noted their pharmacy plan. So I'm going to prelude right now a presentation that was provided to a group of employers by Mr. Patrick Moore. Mr. Patrick Moore is one of our industry leading experts in the Consolidated Appropriations Act, the CAA, which is giving us, if we want to look at it, giving us the power to be able to battle these big insurance companies, these big pharmacy benefit managers, to get our data, because it's saying, and it's putting more light, shining more light on that fiduciary responsibility and what it exactly means to be a fiduciary. If you've never heard of the CAA, that should throw a newsflash, and you need to not only download this, you need to listen to this, you need to share it with everybody in your organization. You need to ask your advisor why you don't know about this. But the reality of it is, the CAA, and as it relates to Johnson & Johnson, and I want to ask and throw it out there, if you say no to any one of these questions, you are probably in breach yourself of your fiduciary responsibility. Now, how much do you pay your pharmacy benefit manager? Do you know? It's not just baked into the cost of your health insurance premium. Do you know how much you pay them? How do they get paid? Can you see how much they paid for that one pill? How much did they sell that pill to you? If you don't know these questions, if you're not able to access that level of data, then how could you possibly be acting in your best opportunity to be that fiduciary? And so what you're going to hear in this overview from Pat is, what is it? But more importantly, where are we going? Because we are on a trajectory that is very similar, and the Johnson & Johnson lawsuit is that first domino. But we are on a trajectory just like the 401k industry got cleaned up many years ago, where class action suit attorneys were targeting employees of employers, saying, is your employer treating your money correctly? And imagine what this means. And Pat will go into this. If in mutual funds or stocks, it's regulated by the stock exchange. Well, the reality of it is you can't pay triple for Google stock. It is what it is. It's regulated. But when the cost of an MRI is $400 to $700, and your plan today is charging somewhere between $3,000 and $5,000, imagine what the regulators are going to think there. So these class action suits, they're happening. An employer got sued for breach. What's next? Continuing listening. Again, whether you're listening live, you'll be able to click and see it live. Whether you're listening audio, you'll hear the audio. Go back and watch this, see the slides. Because on the journey that the 401k and pension world is, we're about at the regulatory phase where enforcement is going to start happening. You don't want to be caught in that breach of your fiduciary responsibility. You don't want to be the advisor that has all of their clients in a situation where they're a breach. And so if you need help, this is something that we help people with. Reach out. But the reality of it is, this is all about impacting healthcare. And if you impact healthcare using the data and being able to access all the data, you could put in the programs, you could put in the transparency, you could put in the incentives and align the incentives between the patients, your employees and their families, the healthcare provider, and how your insurance program works. But it starts all with understanding how you could be the best fiduciary. So take a look at this. And again, thank you for tuning in. Share this, like it, comment on it, let us know what you think, because you are why we grow, and you will understand what the true definition of being a fiduciary really means. I hope you enjoy.
Good morning, everyone. Good morning. Excited to dive into this very, very important and pertinent topic in health insurance in the United States of America. I am leading this. My name is Pat Moore. Some of you know me, some of you don't. Why the heck are you talking or listening to me today? I think that's important. It's important because I have lived two lives, is what I would tell you. I've had a background. I spent 22 years in the United States Marine Corps and just retired last year. And I've also spent a career in group health insurance, advising employers on how to spend money wisely in this healthcare space. And the beginning of my career, I started with some of the bigger shops in the country. Quite frankly, I didn't like it. I didn't like how it worked. I learned a lot, but as I met more and more employers and saw more and more problems, everyone was kind of dealing with the same stuff. Like health insurance goes up, deductibles go up, and it was my job to kind of tell them why that was the case. Not a glamorous job. I compare it to being the dentist. No one really ever wanted to see me. And so a few years ago, I almost got out of this industry. And in fact, I did. I did for a brief period of time. And I got sucked back in. I got sucked back in because I found that you could actually do something about this and started building unbundled health plans across the country in different pockets in which we were accessing all different types of tools, right? And making this complicated, using direct contracting, using transparent PBMs, looking at alternative reimbursement strategies for claims, medical claims, just a gazillion different things, went down a whole bunch of rabbit holes and got excited about this industry. And so I wanted to work with some referral sources, we'll call it that. And I met a 401k advisor that I had done business with in the past and kind of told him like why he should probably care about bringing some of these innovative solutions to his clients, to his folks. And he looked at me, and this was June of 2021. June of 2021. And he looked at me and asked, "Hey, cool, that's really cool. Have you heard anything about this Consolidated Appropriations Act?" And like any good salesperson, he said, "Sure have, absolutely. Why do you ask?" And he said, I really think that the Consolidated Appropriations Act is going to be something that changes your industry. In fact, I've been talking to folks recently that have been telling me about it, and I think it's going to do to your industry exactly what it did for me. I was like, interesting. Well, what did it do for you? And so name was Jeff Goller, and he was the CEO of Strategic Retirement Partners. And Strategic Retirement Partners, when I knew him, was just a small independent shop in Chicago. In fact, I don't even think that was his name. And I can't remember what the name is at this point. But he had grown his shop to 35 offices across the country and hundreds of advisors and thousands of clients. And he blew up. And I was congratulating him. I'm like, how did you do that? And he did that by embracing the Pension Protection Act. What that is really CAA of 401k. And it made advisors in that industry start to be transparent, start to do all the things that they should have done without legislation, but legislation kind of forced their hand. And that fascinated me. And so from that moment on, it took me down in a tunnel of really embracing what it meant to be a fiduciary of a healthcare plan and using kind of the 401k playbook to do it. And so that's what we're going to talk about today. I always hate this part where you have to share a screen and get everything going. But I think you're going to enjoy it. What I'm going to tell you, it's the best stinking CA presentation there is in the game. That's what we're doing today. So, and with that, we'll get it going. So anyways, fiduciary plus healthcare. And so that kind of engagement caused me and Jeff, along with a couple of his founding members of Strategic Retirement Partners, to create a company called Protect. And obviously, you know the Next Impact story. I'm not going to belabor that today. But the combination of these two things are going to be really important for your healthcare plan and also for you as fiduciaries of that healthcare plan going forward. You've seen this slide before in a different capacity, but it's important to hit it, guys. Very simply, healthcare costs in this country are completely out of control. Completely out of control. We're looking at double, triple, 284%, man. When you read the numbers, I do this presentation all the time, but when you read the numbers, it sinks in. It's ridiculous. And we've gotten to a point where costs are $24,000 annual premiums for family healthcare coverage. And we're not even talking about deductibles. There's numbers that don't make sense. It's like, it's a point it's a tipping point in this country because no one can actually afford these things. This is the other side of the coin. And so how can deductibles, how can costs, how can all these things in healthcare be happening at the same time the major health insurance companies in this country have exploded in what their value of their companies are? Everyone always likes to look at what is United Healthcare's stock price now versus where it was at pre the Affordable Care Act. And those numbers make most people puke the first time they see it. And it's good to remind yourself of kind of where we at from a macro perspective in this country. The federal government knows it too. That's all. They figured it out as well. And so that is why December 27th of 2020, they passed this thing that is called the Consolidated Appropriations Act. Now, it was, tucked in with a big bill with a whole bunch of stuff, right? We're going back to COVID, guys. That is the era in which this stuff began. And so COVID relief, PPP loans, the extensions of the CARE Act, that's the stuff people remember. But what was also inside of this was Title I, Division BB, the No Surprises Act. And that kind of added to some legislative changes that happened just before that. That was when TIC got passed, the hospital price transparency legislation passed. And so all these things have put the group health insurance market in a very precarious position, is what I would say. This is kind of what a lot of folks have heard. You now have a whole bunch of stuff to do, right? And most people didn't even really hear that until the last 3 or 4 months, really, with gag clauses becoming a thing at the end of last year. But this is stuff that employers now have to do. And we're not going to spend a ton of time talking about that today. And we can, if these are new things, if you're looking at the screen and saying, Pat, I have to do this, I didn't know I had to do those things. Well, you do, and we'll talk about that. But that's really just the finer details of what this actually means for you. And so removal of gag clauses had to happen at the end of last year for the first time. It's something you need to attest every single year going forward. You should be getting direct and indirect compensation disclosures from your service providers. Most people think of that as like their broker compensation. It's much more than that, and we can get into it. RxDC reporting requirements. This is kind of the requirement that got kicked in last year first. And most people really slept on this, is what I would say. And the big insurance mechanisms pretty much bastardized this requirement. But you have to report your drug spending. Top 50 drugs, kind of a couple of high-level data requirements. And for the most part, if you're on this call, your insurance provider probably just did it for you. We're going to talk about that later, why you probably should have done that, but that's probably what happened. Fourthly, mental health and substance abuse parity. This is the thing that's completely being not paid attention to, quite frankly. And that is the requirements that got put in around, making sure the mental health is as important as physical health. Crazy thought. There's a major thing in that in which all employers need to be doing a non-qualitative assessment of their mental health program. And again, not going to go into the details of that, but it's important. You should be doing it. If you're not doing it, let's talk about it. We can kind of explain why not, and kind of how you can take care of that. This is the whole game. So what Uncle Sam really wants you to do with this legislation is for you to be the fiduciary of your healthcare plan. They realized through this legislation that they couldn't do it. They can't do it. They need employers across the country to fix this. And so a lot of folks like myself realized this years ago. Like, this is not something that can be fixed from a macro perspective. Each employer across this country they have the ability to start to turn the Titanic around by actually spending money appropriately for their employees. And Uncle Sam just doubled down on this. That's what this legislation is telling you. Except it's really a tough job. This is not easy. And so this slide is a slide I love to show because it represents one hospital and one procedure and all the different costs associated with it. The New York Times, that same year, 2021, came out with an article that really highlighted this problem. And they were showing the same thing. This is a colonoscopy. A colonoscopy, a required benefit, a zero cost share, right? And it just shows the crazy differences in price. They highlighted in New York Times as well. It's like, why can you buy that service with no insurance for almost half of what you pay with Cigna? More than half of what you pay with Aetna. And why is Aetna and Cigna a different price? It brings all of this to the surface, because being a fiduciary of a healthcare plan, it's not an easy job. A key topic, something that really brought it all together for me, was this idea of a prohibited transaction. And again, I can shout out to Craig Dewey, Doug Bermudez, and Jeff Cullen. They taught me what this was. And so as I was telling them about healthcare and why the hell they should care about it, and how it works, I described what a PBM was. I described what the charge master was and PPO discounts, and how United Health, like different insurance companies own different providers and they hide reimbursement. Like I was preaching all the things healthcare that I believe. Most of you on this call probably don't know any of that stuff, but that's not important. Put it this way, I talk way too much about healthcare most of the time. Prohibited transactions. In ERISA, this is a thing that says plan sponsors have to ensure that they're not engaging in transactions that could benefit parties of interest over their plan participants. Because at the end of the day, employers are choosing the credit card they take out to use and pay for stuff. Like I compare it when you're going out for dinner. Why is an American Express price different than the Discover price, right? Like using those different examples. And so you as the employer, you're choosing the plan and the reimbursement methods that your folks are getting to use. And so you can't self-deal if you are the fiduciary of a healthcare plan, meaning you can't have multiple financial interests conflicting. And parties of interest, sorry to talk in ERISA jargon, I try not to do that ever, but service providers are really the insurance companies, the PBMs, the different folks that make up a healthcare plan. And so if you look at the first two slides we started off today, I came to the conclusion in that call, or in that discussion, that prohibited transactions, that was everything in healthcare. And they agreed. That's where I just decided that this was a problem. And so what we're seeing in in healthcare specifically is that we are at a point where we are mimicking that Pension Protection Act. And so I talked about the 401k folks wanting to, oh, look at me. I started over. We'll just go down. I'm sorry about that, guys. What we talked about is where and how the 401k industry changed. It wasn't the legislation that changed anything. Like the legislation happened and it took almost 10 years for it to really sink in. It was really when lawyers figured out that they could make a buck by forcing employers to actually uphold the standards that were in the legislation. And so things happened, things changed when class action lawsuits hit. What I would tell you is we are right at the very beginning of that on the healthcare space, and we'll talk about that further. Anthem, Ford, Bricklayer Union, Aetna being sued by Kraft Heinz. There have been lots of court cases going on in this country for the past year or two. It's been basically employers suing their plans, their health plans. And this has all been really, really interesting, all well and good. But really what it's been has been muddying the water. Because at the end of the day, it's not about the insurance companies. Like we're seeing this play out in case law, and I hope it changes. But what we are seeing is they are trying to muddy the waters because they know that an employee, the real problem is employees can sue their employers over this problem. Because at the end of the day, the plan sponsor, the actual company providing the benefit, it is their duty to make sure that crazy stuff isn't happening in their health plan. And they know that. Most attorneys know that. And so a certain court case, which is why we're having this presentation today, I've added to this slide up in the corner, and that's Johnson & Johnson. And this is going to be interesting because this is the first case where it is an employee suing their employer over their breach of fiduciary responsibility. Pause on that, more to come. And so I want to introduce everybody to this guy. This guy is Jerry Schlichter. Jerry Schlichter is that guy that is known for suing employers for breach of their in breach of their ERISA fiduciary responsibility. He was on the 401k side. He made, the numbers that we show, these are for 2016. It's not exactly known how much money he's paid doing this, but, probably well over $500 million suing plan sponsors for breaching their fiduciary responsibility. Which is interesting because when I start to read through the court cases, they're boring, but it's so minute what he is arguing. Like I saw cases where he was suing big university health 401k plans over, not having a Vanguard mutual fund with a 0.05% fee versus a 0.07% fee, and arguing that they were bridging the gap between those percentage points. And he's right? Like, and that ends up being big sums of money, and he won lawsuits doing that. This is not even compare to what is healthcare. And so for the folks that know, like when you can get an MRI for $7,000 versus $700, and I guess I've seen worse and better in both directions, but I'm just trying to be transparent here. This stuff is insane when you apply ERISA to healthcare. And it really opens up the floodgates of what's possible, because what I always like to say is in the 401k world, there's only so much bad stuff that can happen. Because at the end of the day, they have a stock market. It regulates prices. In healthcare, we don't have that. I can't even try to buy AT&T stock for double or triple what it's listed for on the stock exchange, because it doesn't work that way. Like it's worth what it's worth, and you buy it. But if I needed a knee surgery, I can definitely overpay for that all day long. And so he knows this. He knows everything that I've shared and talked about today. Starting last fall, he started reaching out to employees of the different Fortune 500 companies, advertising them directly. And the advertisements are this: are you a current so-and-so employee who has participated in the company's healthcare plan? You may have a legal claim. Pretty damn bold. The bold thing is that I love to show this. Like, this is Anthem, right? This is Anthem, the big insurance carrier. This is not who he's going after. He's going after Anthem, the company healthcare plan sponsor. He's going after Anthem's healthcare plan. Wild. Wheelbarrow for those, if you know what I mean. What I always say is count me in, Jerry, because I've always cheated healthcare. I've been in healthcare. I've talked about unbundling, but I told you I spent 22 years in the Marine Corps. And so I've always had TRICARE. And my wife has a prescription that she uses. And it cost me $14.26. We do the 90-day fill, it costs $14.26. If I bought that in cash outside of TRICARE, which is one of the biggest healthcare plans in the country, it would cost me $5. Well, I can Pat Moore buy in cash what TRICARE pays 3x for. It makes absolutely no sense as to why some of the biggest healthcare plans in the country overpay for the simplest of things every single time. It goes against everything that people think. They think that they are getting the best deal when they use their health insurance, and they just rarely are. And so we're talking about suing. We're talking about this. That is not where most of you on this call sit. You're probably not going to get sued. Mr. Schlichter's not going after you. He's going after bigger pocketbooks, right? But violations, ERISA violations that is what we're talking about. And so, specifically gag clauses, we can talk about it, but these are the penalties. It's $100 per day per employee. Gigantic sums of money. The example I show is there's a 500 employee company. We're looking at $18 million in maximum liabilities. It's game over type stuff, right? If you're doing this wrong, and if Uncle Sam really goes after someone, and quite frankly, you have liability everywhere. And so the part that kind of takes us to another notch is, and I learned this from the 401k guys, is this is personal. Like, when you're a fiduciary of a plan, you have personal liability with this. When you're the signer of the 5500, when you're the person making these decisions, there is personal responsibility. And so something else that I think is interesting, like if you're a K1 earner, right? If you're an owner, I got to be that for the first time about 10 years ago. And I thought it was the coolest thing ever, to get a K1 and have ownership of a company. This is you. If you are a K1 earner and you have a healthcare plan, you need to now kind of pay attention to all the geek stuff that you're hearing today. That what you just witnessed is literally mostly the presentation I've given for almost 2 years now. As I've as I've spoken to employers across the country, and I've spoken to brokers across the country, that's been the presentation. I told you I added that J&J lawsuit to the docket, and that happened. That happened on February 21st, I believe is when that dropped. Maybe I'm a little off on that, but this changes the game. This is that lawsuit where an employee sued an employer, and what the lawsuit alleges is that Johnson & Johnson breached their fiduciary duty, specifically the duty of prudence. They didn't properly explore their options for pharmacy. They took advice from parties with conflicting interest, all the things. And the example, it felt like one of my presentation screens about my wife's drugs, but they literally just put snippets of what you could buy a drug with cash versus what you could buy a drug through the Johnson & Johnson plan. This was a better example than mine. I'll give it. I didn't have this drug to use as an example. What they showed very simply is Johnson & Johnson was paying $10,000 per month. Actually, 90 days. I take it back. 90-day fills. For something that if you didn't have insurance and you just walked in with a good RX app, you could probably get for $78. If you use a Mr. Cuban and the cost plus drugs, he has an exact drug for $28.40. When you say that for people that understand health insurance, they get it. But when you tell that to someone who doesn't, it blows their mind. And yes, that's like a thing in the United States of America. They use more examples of leukemia drugs, HIV drugs, all these different things. But this is what they're getting sued over. It's am I forcing my employees to purchase inside of my healthcare plan? Maybe I should take a look at this stuff. In another instance, part of the lawsuit was, a member was dissuaded from using an out-of-network option for an infusion, even though it would save the plan $40,000. Yes, you could literally save that type of money choosing to do an infusion in a different place. But in this healthcare plan, they forced that infusion to be done in the most expensive place possible. It doesn't make any sense. And so this is the part that also brings it home. This lawsuit didn't just list Johnson & Johnson. Remember that part where I told you, like with fiduciary risk liability, you have personal responsibility at play here. And this lawsuit also mentioned 23 employees, all the members that were part of the pension and benefits committee. If you're an HR director, if you're a CFO, if you're a benefit analyst, all those people that make decisions on a healthcare plan for a company, they got listed personally on this lawsuit. It kind of brings it all home. And so visiting exactly what this means, I got this slide from my homegirl, Julie Slaznick. She is a ERISA attorney at Berger Montague, and she talks about two things when we talk about fiduciary responsibility: the duty of prudence and the duty of loyalty. And these are important tenets to understand, right? But this is kind of legal speak. This is complicated, and it's kind of like the recipe, right, for what you need to do from a employer responsibility standpoint. And I like to think of this as the only people that can actually help fix this problem are the chefs in this industry. There's a lot of people talking about the recipes, the things you have to do, but the chefs that are getting in and can actually make a difference in building a health plan that makes sense are going to be the people that are really needed, especially after this Johnson & Johnson industry. And so we see this as this, and you've seen this before as a Next Impact client, but we focus on quality, we focus on reasonable costs, we focus on being proactive, we focus on member advocacy. This is no longer something that, you should consider for your health plans. In our humble opinion, this is now something you almost have to do. You have to decide if you're going to kind of go big or go home. And I hope you enjoyed this presentation today. I hope this is something that was educational, and we're looking forward to talking to more of you afterwards. Again, I apologize for kind of having just to speak at you this morning, but with all the people on the line, we didn't want to clog the presentation. It was an absolute honor. I thank Lester and the Next Impact crew for letting me do this presentation, and looking forward to talking to you all. Thank you very much.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.